Hi, my name is Rosie, and my ID is 107402885. Today, I will talk about virtual healthcare for community management of patients with COVID-19 in Australia by the observational study. We all know that Australia has successfully controlled the COVID-19 pandemic, similar to other high income countries. Australia has extensively used telehealth service, virtual healthcare, including telemedicine in combination with remote patient monitoring, has been used in certain settings as a part of new models of care that aim at managing patients with COVID-19 outside the hospital setting. So, this study aimed to describe the implementation of an early experience with virtual healthcare for community management of patients with COVID-19. And we use the observational study as a method. So, let's get started. So VHC virtual healthcare is a model is a of health service delivery, which substitutes in-person consultation with telephonic and video um, consultants and often includes data collection from the patient via surveys tools with or without real-time remote monitoring. So as the method I mentioned before, it is observational study, cohort study. So first, let's looking at the setting. So the setting is Sydney Local Health District, SLHD, is a large metropolitan public health service in New South Wales, Australia. And this areas including 5 hospitals, 4 large community health centers, and 12,000 staff. This area is responsible for health and well-being of approximately 700,000 individuals living within its geography boundaries and approximately 1 million individuals who travel to the city each day for work, study, and recreation. And co-located in the Royal Prince Alfred Hospital campus in Camperdown, New South Wales, RP, RPA Virtual is a 24/7 care center with technology-enabled multidisciplinary team rooms, handover areas, tracking boards, and several care ports. The keyboards provide access to electronic medical record (EMR) and shared care planning and remote monitoring tools. They are equipped with their video conference and telephone facilities and are staffed by nurses who can remotely monitor multiple patients simultaneously. The facility has medical staff on site and under the supervision of clinical director and director of nursing, and they including a team of more than 100 community nurses are available to deliver in-home nursing care to complement VHC service. So population, uh, the individual for the target patients are who can register for this kind of service. They are individuals over 65 years of age with significant comorbidity. It's noted that it not included cancers, cardiovascular disease, diabetes, heart failure, immunosuppression, stroke, liver disease, renal disease, and lung disease. And individuals under 65 years of age with one of the more of the following comorbidity: lung disease, cardiovascular disease, renal disease, uncontrolled hypertension, individual at residential aged care facility, individual aged less than 16 years old and pregnant women. And next is the modem of care. This based on early detection of deterioration and managed escalation for deteriorating patients. Vital signs including respiratory rate, oxygen saturation, pulse rate, and temperature were monitored at home. Blood pressure monitoring was not required, and the care center contracted patient a pre-arranged interval twice a day, including a video consultation with the patient twice every 24 hours. And especially for the pregnant woman, there's some noted that they receive more intensive care and concerns. So about the clinical assessment is airway and breathing, use the respiratory distress, respiratory rate, oxygen saturation, and other respiratory symptoms. How about the cardiovascular system, appearance and heart rate, disability, alertness, coordination, mental state, and mobility, exposure, which is a major temperature, and fluid balance, which is measure fluid and food intake, and gastrointestinal symptoms and losses, glycemic control, blood glucose level. So this experiments is considered as very wonderful for some patient, and they rate like 5 star. So there's some patient experience that their patient feedback is once enrolled in VHC, new patients were provided with a welcome pack containing the following items: a welcome letter and video conferencing instruction, pulse oximeter, instruction for its use, and temperature monitoring device and instruction for use, New South Wales Government COVID-19 fascist, and a patient responsibility pampers pamphlet. So, and there also personal protective equipment PPE was provided immediately after COVID-19 testing and then resupplied with the welcome pack. The welcome pack was delivered by a flying squad of health informatics staff wearing appropriate PPE upon completion of a home visit risk assessment. The RPR Virtual Flying Squad instructed patients to wear PPE when answering the door and notify patients when they are 5 minutes away from their homes. The patient interacted with RPR virtual team through video consultations and toll-free telephone service that open 24 hours. Calls were scheduled with the patient to collect their self-observation. Patients were advised to call the RPI virtual call center or an ambulance if they experience deterioration. So here are some medicine that used in the service. The first one is remote monitoring technology. These are evaluated to collect their patient-generated health data from patients with COVID-19 in accordance with defined criteria, which are including capable of measuring the desired clinical parameters like heart rate, oxygen saturation, temperature, respiratory rate, capable of remote dating data collection and transmission, or able to be read by patient. Usability for the medical team at Royal Prince Alfred Virtual Hospital. Usability for patients with COVID-19 admitted to the Royal Prince Alfred Virtual Hospital. Training and support requirements for the health informatics staff at Sydney Local Health District. Listed on the Australia Register of Therapeutic Goods therapies good administration, supply chains availability to meet the scale, speed, and demand of COVID-19 response, and cost, and compliance with the cybersecurity, data security, and privacy, infection, and control requirement. So here you can see the remote monitoring technology. Here you can see here we can have the demo hospital, we have temperature, we have patient list for best results and setting. So next is video consultant. Video consultant will carry out to visually assess their patient, confirm vital signs recorded by wearable device, and estimate the respiratory rate. The RPR virtual care ports were fitted with high-definition webcams and Bluetooth-enabled headsets to allow the patient to see and hear the nurse. And these were also make sure that guaranteeing the privacy for during the conversation with the patient. And the result. The first one is on the 29 November of 2020, 5,821 individuals were tested for COVID-19 at SLHD COVID-19 testing clinics, and 173 individuals tested positive. The second result is the patient were contacted 2,865 times with a median of 16, range from 1 to 50 contacts per patient. The third one is employees were called to attend to 5 patients, and 4 patients were transferred to the emergency department for assessment. The last one is the median number of admissions per day was 6. So we can see that this service was very effective, and it can be the future of um, can help to assist to cure the COVID-19 in some country, to follow the success of Australia. So thank you for listening.